Hello and welcome to the Technical Assistance Pre-Application webinar for the ComPASS Coordination Center, RFA-RM-23-001. My name is Nadra Tyas and I am a program leader at the NIH Common Fund, and we are delighted that you are joining us this afternoon. Next slide. The Coordination Center funding opportunity announcement that will be discussed today is an initiative within the NIH Common Fund program called the Community Partnerships to Advance Science for Society, or better known as ComPASS. Before we discuss the specifics of this FOA, I would like to start by walking you through today's agenda. Next slide. First, I'll introduce you to the ComPASS leadership team and webinar panelists. Next, I'll provide an overview of the NIH Common Fund program. Then we'll move into the ComPASS overview and more about the ComPASS Coordination Center funding opportunity. Next, peer review information will be discussed along with eligibility criteria, the budget, and the letter of intent. Then we'll talk a little bit about the U24 mechanism and end with a question and answer session. It is our hope that at the conclusion of this webinar, you will have enough information to prepare your application. Next slide. ComPASS was developed in partnership with over 30 NIH staff under the leadership of 5 co-chairs listed here. The co-chairs continue to provide strategic insights and vision for the overall ComPASS program. First, we have Dr. Janine Clayton, the Director of the Office of Research on Women's Health. Our next co-chair is Dr. Joshua Gordon, the Director of the National Institute of Mental Health. Dr. Eliseo Perez-Stable, the Director of the National Institute on Minority Health and Health Disparities, serves as additional co-chair. Dr. David Wilson, the Director of the Tribal Health Research Office. And last but not least, Dr. Shannon Zink, the Director of the National Institute of Nursing Research. Next slide. We also have a great lineup of panelists to highlight various elements of ComPASS and this funding opportunity. Allison Brown, one of our work group coordinators and also program director at the National Heart, Lung, and Blood Institute, will provide an overview of ComPASS and its various initiatives. Shalonda Bynum, another work group coordinator and program director at the NINR, who will cover the requirements of the Coordination Center. Nathan Stinson, the third work group coordinator, is the Director of Community Health and Population Science at NIMHD, who will review the eligibility criteria and other FOA components. Yvonne Ferguson, a program leader at the NIH Common Fund, will facilitate our Q&A session. Next slide. And finally, we have Jessica Bellinger from the Center for Scientific Review, who will discuss the peer review criteria, and Kelly Oster, lead grants management specialist at NINR, will discuss the U24 mechanism. Next slide. As mentioned, ComPASS is a Common Fund program, and the Coordination Center that is being discussed today is the ComPASS initiative. So what is the Common Fund? The NIH Common Fund is under the Office of the Director and is managed in partnership with the NIH Institutes and Centers. These programs are designed to address emerging scientific opportunities and pressing challenges in biomedical and behavioral research that no single institute or center can address on its own, but are a high priority for NIH as a whole. Common Fund programs are intended to foster innovative ideas with transformative impact, change paradigms, provide infrastructure to support research, develop innovative tools and technologies, and provide fundamental foundations for research that can benefit the broad biomedical and behavioral research community. As illustrated here, Common Fund programs are developed to be transformative, synergistic, catalytic, cross-cutting, and unique. Next slide. The NIH Common Fund is meant to drive the mission of NIH forward and faster. It does so by supporting bold scientific programs that catalyze discovery across all biomedical and behavioral research. Common Fund programs also advance areas of biomedical and behavioral research important to the missions of multiple NIH institutes and centers. These programs therefore spur biomedical and behavioral advances that otherwise would not be possible without an initial strategic investment. Now that we have covered the background for NIH Common Fund programs, I will now turn it over to Allison Brown, who will highlight the ComPASS program and its 3 initiatives. Next slide.
Thank you, Nadra, and good afternoon, everyone. As she mentioned, in the next segment of this webinar, I will review the goals, initiatives, and activities of ComPASS. Next slide. So the Common Fund program goals are defined in a way that they are achieved within 10 years. And the overall goals of ComPASS are twofold. So the first goal is to catalyze, deploy, and evaluate community-led structural health equity structural interventions that leverage multi-sectoral partnerships across many different sectors to reduce health disparities and advance health equity. And the second goal is to develop a new health equity research model for community-led multi-sectoral structural interventions across NIH and other federal agencies. As highlighted in these goals, partnerships with multiple sectors, including community organizations, federal agencies, businesses, and local and state governments, will be key in achieving these goals for ComPASS. And these key partnerships will be established through the formation of local and national health equity research assemblies, also known as HERAs, which will provide national and more localized assistance in the development, implementation, assessment, dissemination, and sustainability of these community-led health equity structural interventions. Next slide. So to carry out the goals of ComPASS, there are 3 distinct initiatives. First, there are the community-led health equity structural interventions, also known as CHESIs, which will fund up to 25 community-led structural interventions. Then there are the health equity research hubs, which will provide localized technical assistance and scientific support. And 5 health equity research hubs will be funded beginning in fiscal year 2024. And lastly, the Coordination Center in the focus of today's webinar, which will lead overall program management and coordination of the administrative, data, capacity building, partnership, training, and the National Health Equity Research Assembly activities. And there will be 1 award for the ComPASS Coordination Center. So the ComPASS program will be again for 10 years, and the planned budget is approximately $153 million over the first 5 years. And overall, this significant investment highlights the NIH's commitment to advancing health equity. Next slide. So in summary, ComPASS goals will be achieved by the following activities. So first, by promoting community organizations and their research partners and co-creating research to evaluate community-led health equity structural interventions. ComPASS will also engage multi-sectoral partnerships, both locally and nationally, in advising, guiding, and sustaining these health equity structural interventions. It will build the research capacity in structural intervention research and implementation, community-led research, and sustainability among community organizations and their research partners. It will also lead to the development of methods for capturing social determinants of health information and collecting and analyzing data to evaluate outcomes from community-led health equity structural interventions. And lastly, ComPASS will contribute to the dissemination of promising approaches resulting from these innovative interventions. So now we will move into a discussion of the specifics of the Coordination Center funding opportunity, where Shalonda Bynum will highlight the core components of the center. Shalonda, the floor is yours.
Thank you, Allison. In this segment of the webinar, I will discuss key components of the ComPASS Coordination Center. Next slide. So again, the purpose of the Coordination Center is to lead overall program management and coordination of administrative, data, capacity building, partnership, training, and the National Health Equity Research Assembly activities across the 3 initiatives previously discussed by Allison. Next slide. The Coordination Center is comprised of 3 core functions. The administration and coordination function is responsible for overall management and coordination of the ComPASS program. The data collection, management, and assessment function will manage data infrastructure, collection, security, sharing, and analysis for the ComPASS program, including identifying and collecting common data elements. And lastly, the research capacity building and training function will be tasked with developing, identifying, and facilitating common research capacity building training activities across the ComPASS program. I will now provide a little more information about the 3 core functions I just mentioned. Next slide. So the responsibilities of the administration and coordination core function are to provide overall management of ComPASS administration, coordination, reporting, engagement, outreach, dissemination, and sustainability activities. To establish and initiate the National Health Equity Research Assembly, or HERA, and I'll discuss a little more about the HERA in the subsequent slides. Provide scientific and technical assistance to intervention awardees, develop a collection of structural intervention strategies, policies, and programs, develop and facilitate topic-specific communities of practice and peer mentoring opportunities, and support the IRB process for intervention awards if needed. It is important to note that this is not an exhaustive list and that you should refer to the FOA for additional elements. Next slide. So central to the ComPASS Coordination Center is the establishment and management of the National Health Equity Research Assembly. The National HERA will comprise an invited group of federal and non-federal members, such as those in transportation, housing, urban planning, and public health sectors to provide vital consultation on the development and implementation of the intervention projects. And these national level representatives will facilitate successful research collaborations and opportunities. Local HERAs will also be established by the intervention awardees based on consultation from the National HERA and the needs of the specific intervention projects. Each intervention project will have a local HERA comprised of tribal as appropriate, state, regional, and local government and relevant private sector partners to guide the intervention at the local level. Next slide. Some elements of the data collection, management, and assessment function include providing leadership and expert consultation, coordination and collaboration, as well as technical assistance to support all ComPASS-wide data activities, developing and implementing a data collection and sharing protocol that includes a collaborative decision-making process, identifying and collecting common data elements that can be used to standardize the collection of SDOH measures, health outcomes, and other important variables, developing and implementing a ComPASS-wide data analysis plan, developing and documenting infrastructures to support data entry, verification, and quality control, and creating and implementing an assessment plan and conceptual or logic model to study ComPASS-wide activities. Next slide. The last core function is research capacity building and training, with responsibilities including but not limited to conducting a research capacity building and training needs assessment with ComPASS awardees and their research partners, using the needs assessment results to develop and implement virtual and in-person research capacity building training and curricula, developing and sharing capacity building and training content, curricula, and educational resources, and providing coordination support to the health equity research hubs on the development and implementation of research capacity building, training, and technical assistance for specific intervention projects. I will now briefly highlight two additional elements that will be considered in the assessment of scientific merit. Next slide. So milestones are required for all applications submitted in response to this announcement. Milestones are intermediate steps towards the completion of concrete goals. Applications should include clearly specified, well-defined milestones, quantitative go, no-go decision points, and a timeline for assessing progress. Additionally, the Coordination Center awardee will need to submit yearly quantitative milestones to provide clear indicators of continued success or emergent difficulties. Next slide. The last element that I will share with you today is the data management and sharing plan. NIH requires all applications planning to generate scientific data to prepare a plan that describes how the scientific data will be managed and shared. It is our expectation that researchers maximize the appropriate sharing of scientific data. This plan will be evaluated as part of scientific merit, as mentioned previously, so be mindful of that when outlining your strategy. For a complete list of documents and information on the data management and sharing plan requirements, visit the website sharing.nih.gov. So now that we have provided an overview of ComPASS, its various initiatives, and the 3 core functions of the Coordination Center, I will pass it over to Dr. Stinson to lead us into the next segment of the webinar.
Thank you, Shalonda. In this section, I will review the eligibility criteria, discuss the budget, and the letter of intent. Next slide. There are a few eligibility criteria that we would like to mention. In terms of eligibility, applicants must be either an institution of higher education, they are public or state institutions of higher education, or private institutions of higher education. Nonprofits other than institutions of higher education, such as nonprofits with or without 501c3 status. For-profit organizations who are small businesses, for-profit organizations other than small businesses. Local governments such as state, county, city, special district, and American Indian, Alaska Native tribal governments, and U.S. territories or possessions. There are also a few institutions that are not eligible to apply for this opportunity. They are non-domestic, that is non-U.S. entities or organizations, non-domestic components of U.S. organizations, and foreign components as defined in the NIH grants policy statement. Next slide. The budget for your proposed application should reflect the resources needed to perform the duties of the Coordination Center as outlined in the RFA. For fiscal year 2023 and fiscal year 2024, you can request up to $3 million and up to $6 million per year for years FY 2025 through FY 2027. You must submit a base budget estimates for all years, including budgets for staff or personnel, including biostatistical and data science support for data activities. You must also include travel costs for the center, principal investigators, and key personnel of the Coordinating Center to attend an annual ComPASS program meeting. Lastly, although ComPASS is a 10-year program, your initial project period budget should not exceed a 5-year time frame. Next slide. Although a letter of intent is not required, is not binding, and does not enter into the review of a subsequent application, the information that it contains allow institute or center staff to estimate the potential review workload and plan the review. Your letter of intent, if you decide to submit one, should include descriptive title of the proposed center, names, addresses, and telephone numbers of the project directors or principal investigators, names of other key personnel, participating institutions, and the number and title of this funding opportunity announcement. The letter of intent should be emailed 30 days prior to the application deadline to cfcompass@od.nih.gov. My colleague, Jessica Bellinger, will now discuss the criteria that will be used to assess the scientific merit of the applications submitted in response to this RFI. Next slide.
Thank you. So I will discuss the review criteria for this funding opportunity announcement, as well as point out key sections of the RFA to pay attention to in preparing your application. Next slide. But before I go into the highlights of the peer review process, it's important to understand the purpose of peer review, which is to see that grant applications submitted to NIH are evaluated in a manner that's fair, that's independent, expert, and timely, free from inappropriate influence. There are two levels of review used by NIH. In the first level, experienced scientists and clinicians with expertise in the relevant disciplines are convened to review the applications submitted. In the second level of review, the IC's Advisory Council review the applications. And the advisory counselors are composed of both scientific and public representatives. Final funding decisions are made by the IC directors in consultation with program officials. Next slide. For this RFA, the Center for Scientific Review will convene a special emphasis panel to review applications in response to the RFA. Applicants do not need to provide a recommendation for a study section assignment. The reviews will take place in July of 2023, and all applications will receive a written critique. Only those applications that are deemed to have the highest scientific and technical merit will be discussed and assigned an overall impact score. 30 days after the meeting completion, summary statements will be provided. And the summary statement is the official record of the review process as well as the results. It provides a summary of the key discussion points that resulted in the final composite score, as well as the comments and scores of assigned reviewers. Next slide. There are some important time points to keep in mind during the review process. First is the application deadline. It's important to submit the application before the deadline to allow time to make sure that any errors can still be corrected. After the application is submitted, they are received and processed by the Division of Receipt and Referral at the Center for Scientific Review. Each application is assessed for completeness and assigned for review, in this case, to a special emphasis panel run by CSR. Program staff will assess the responsiveness of the applications, and non-responsive applications will be withdrawn from review consideration. The scientific review officer is responsible for assembling a panel of expert reviewers to conduct the review of the technical and scientific merit of the applications. Next slide. The integrity of the peer review process is critical to ensuring a fair, independent, expert, and timely review. And confidentiality is a major component of that. The review materials and proceedings of review meetings represent confidential information for reviewers and NIH staff. Reviewers do not discuss review proceedings with anyone except the SRO outside of the meeting. And likewise, applicants should never communicate directly with any member of a review panel about an application. And this confidentiality is lifelong. If there are any questions about the review proceedings, those questions should be referred to the scientific review officer. Next slide. Reviewers will evaluate 5 scored review criteria in the determination of the scientific merit of each application. And those scored review criteria include the significance, the investigators, the innovation, the approach, and the environment. And the reviewers will assign a score of 1 through 9 for each of those review criteria. They will then assign a score of 1 through 9 for the overall impact of the application. And for the overall impact, this is the assessment of the likelihood of this project to exert a sustained and powerful influence on the fields involved. Next slide. Specific to this FOA, the review criteria include RFA-specific considerations. So it's important to refer to Section 5, the application review information, and read that quite carefully. In addition to the core review criteria for the significance, reviewers will consider, is the scope of strategies, activities, and methods proposed for the ComPASS Coordination Center appropriate to meet the core functions? How well will the coordination, assessment, research capacity building and training, outreach, dissemination, and sustainability activities contribute to the success of ComPASS? And will the successful completion of the aims and research strategies facilitate the ability of the CCC to provide national leadership and engage multiple partners in supporting and enhancing structural level interventions? For the investigators, specific to this RFA, the reviewers will consider whether the CCC staff include all relevant expertise. Does the project team include experts in community-based participatory research, community-engaged research, health equity, health disparities, research capacity building and training, as well as experts in study design and implementation science? Next slide. For the innovation, specific to this RFA, reviewers will consider whether the applicant demonstrates that the proposed coordination, data management, and capacity building and training strategies can adapt to changing and various needs of the research consortium through all phases of ComPASS. For the approach, reviewers will also consider whether the proposed approach will allow for effective intervention planning and impactful implementation of health equity structural interventions for community organizations and their research partners. Will the proposed strategies effectively support the ComPASS administration, management, and coordination activities, including the development and facilitation of the national HERA? And will the proposed strategies for the CCC functions enhance collaboration, synergy, and impact of the consortium? Will the proposed approach support the measurement of health outcomes and support the establishment of common data elements? Will the proposed approach support the development and dissemination of models and frameworks? And reviewers will also consider whether the milestones are appropriate and feasible to the CCC goals and functions. Again, it's important to refer to the specific FOA for more information about the core review criteria, as well as the RFA-specific review criteria considerations. Next slide. There are a wealth of resources available to assist with grant submission. And a key point to remember is that if there are any issues with submitting your application, always contact the ERA service desk at http://grants.nih.gov/support. Now I will turn it over to my colleague, Kelly Oster, to discuss the components of the U-24s.
Thank you, Dr. Bellinger. This RFA utilizes the U24 mechanism, which is a cooperative resource-related research project. I will be discussing the core components of the U24 cooperative agreement. Next slide. A cooperative agreement is used when there will be substantial federal scientific or programmatic involvement, as in this initiative. Substantial involvement means that, post-award, NIH scientific or program staff will assist, guide, coordinate, or participate in project activities. The NIH purpose is to support and stimulate the awardee's activities. It is not to assume direction, prime responsibility, or have a dominant role. Next slide. A complete list of terms and conditions can be found in Section 6 of the RFA. Here are some highlights. The PI will provide scientific leadership for all aspects of the Coordination Center, will determine approaches, design protocols, and propose project milestones for core center functions, will adhere to the NIH policies regarding intellectual property and data security, and will establish reporting timelines and provide periodic reports and data in a timely fashion and format. Recipients retain custody of and have primary rights to the data, technologies, and software developed under the ComPASS program. There will be one project scientist for each core function: administration and coordination, data and assessment, and research capacity building and training. The project scientist will serve as the NIH scientific representative to the investigators under the policies and procedures of award, will provide substantial NIH scientific and programmatic involvement, and will work closely with the program official and ComPASS awardees to maximize progress towards the program goals. There will be two program officials for this award, a primary and secondary. The program official will provide scientific and programmatic stewardship, including monitoring progress and compliance with general policies and regulations. Will provide programmatic stewardship on data collection and management activities, and will approve annual milestones and any significant changes to the award. The program official will provide technical assistance to correct performance and facilitate interactions, and can recommend award restrictions based on progress towards milestones and implementation of policies. And now I'll pass this on to Dr. Ferguson, who will discuss how to submit questions.
Thank you, Kelly. We now welcome you to submit your questions to the email address provided on this slide, which is cfcompass@od.nih.gov. We also encourage you to check out the frequently asked questions, which can be found on the ComPASS program website at http://commonfund.nih.gov/ComPASS. Thank you.